Why do I need x-rays? We in the dental field hear this question on a daily basis. X-rays are the primary method for diagnosing the majority of conditions we deal with in dentistry, including cavities, gum disease, and various types of dental infections and pathology. Bite wing x-rays, sometimes referred to as checkup x-rays, are the best type of x-rays for diagnosing cavities in between the teeth. If x-rays are taken once a year, cavities can usually be diagnosed and treated while they're still small, before they can progress deeper into the tooth. X-rays are also important in helping diagnose gum disease, as they can show loss of bone support around the teeth, which is the hallmark of periodontal disease. What's referred to as a full mouth series of x-rays is an important set of x-rays typically taken once every 5 years to show every tooth in the mouth in detail. A full mouth series includes the bite wing x-rays we discussed a moment ago and is truly the best way to diagnose cavities, abscessed teeth, and bone loss associated with periodontal disease. Another important type of x-ray is a panoramic x-ray. This x-ray shows all the teeth, both upper and lower jaw bones, the maxillary sinuses, and TMJs, to name a few things. Because this x-ray shows a broader view, it can be used for multiple different purposes. Sometimes panoramic x-rays are taken on children to show how the adult teeth are developing and can be helpful in determining if orthodontic treatment will be needed. Additionally, panoramic x-rays are generally the ideal way to visualize impacted wisdom teeth in adolescents and young adults. These types of x-rays can even help identify as an incidental finding an undiagnosed carotid artery calcification in adult patients that could have potentially led to a stroke. Another type of imaging that is extremely useful in certain cases is a 3D x-ray, known as a cone beam CT scan or CAT scan. Whereas traditional dental x-rays are two-dimensional, a CT scan is three-dimensional, so the level of detail that can be visualized is so much greater. There are cases when a patient will be complaining of tooth pain and there's no pathology visible on a traditional 2D x-ray, but when you take the 3D, the problem becomes crystal clear. CT scans can also be helpful in visualizing complex anatomy inside the tooth prior to doing a root canal. Another primary use of CT scans is in surgical treatment planning for dental implants. Since the CT scan offers a 3D view of the patient's jaws, it's extremely useful in visualizing both the height and width of the site where the implant is to be placed, as well as in identifying important anatomical structures such as nerves, blood vessels, sinuses, and irregularities in the bone that will need to be avoided during the implant placement. In addition to that, the software that accompanies the imaging component also allows the treating doctor to perform a virtual surgery prior to performing the surgery on the patient. This is a huge benefit, as it allows an extremely accurate level of pre-surgical planning so that the length and diameter of the implant to be used is all pre-planned, as well as the angulation, spacing, depth of placement, etc. Not only is it comforting to patients that this degree of planning is done prior to the surgery, but making all these decisions beforehand greatly reduces the actual surgery time as well, and who doesn't want that? One of the objections we frequently hear from patients with regard to taking dental x-rays is that they're concerned with the radiation exposure. The great news is that our x-ray imaging is completely digital, and digital x-rays are about 90% less radiation than traditional film x-rays, which is huge. As an example, the radiation exposure from a single dental x-ray is 0.1 microsieverts. To put it into context, eating a banana would give you 0.2 microsieverts of radiation exposure, so it is really, really minimal. Even with CT scans, which emit a much higher degree of radiation, the radiation exposure is comparable to what you would be exposed to on a cross-country flight from New York to Los Angeles. When you put it into context, realizing that there is radiation all around us, everywhere, all the time, it really lessens the concern about exposure to dental x-rays.